This is Erica, and that's Ashley. If you haven't met her, she's my mini me. Anyway, I'm being silly. So I wanted to talk about something because I don't see any questions, but I wanted to talk about something that I've heard about a lot in this past week, which is hidden forms of deprivation when you don't realize that you're actually sort of in the diet mentality. You think you're doing intuitive eating. For example, I spoke with someone this morning who was telling me that she just can't keep chocolate in her house. It just can't, God forbid if she has it in her house, it will disappear. And I talked for a long time about the notion of deprivation, and when you are deprived of something, you want it all the more. So even if you think you're doing intuitive eating and you still restrict yourself, you're dieting. You're dieting. And I went on to describe, I'll just say, I'm going to be honest with everyone. I do everything I tell my patients and my clients to do, including once I got a tube put in because I wanted to know what tube feeding felt like.
Oh,
so I did everything short of shots, but I'm being really silly.
You don't like shots, but you'll do tube feeding? That sounds so much worse.
I was at a cancer center, and I really wanted to understand what it felt like to have a tube.
Oh,
sounds
awful.
I was the guinea pig. Yeah. I feel like I want to experience it. I've been on every diet. So if you want to know what a diet feels like, I'm happy I can answer. But I went through the whole thing about stocking. When you have foods in your house and they're always available, you really do get sick of them, and you really can make a decision about whether you want them or not. And I have at any moment, I have like 6 different things of ice cream in my freezer. There was never a time in the past that I could have kept that in my freezer. And I just kept it out of the house. I didn't think I could ever have it in the house.
Yeah.
That's really what I'm talking. What do you think about it, Ashley?
Oh, no, same thing. When I was like in my eating disorder, but a lot of it's a common misconception that binge eating disorder only includes binging and doesn't include restriction, right? Mm-hmm. But in truth, binge eating disorder is often in response to restriction, whether physical or psychological. And so, basically I would try to restrict all day, and then at night, my stomach would be like, what is wrong with you? You need to go eat. But then, of course, because I was so hungry, I ate so much, and my brain was like panicking that I wasn't going to get enough food. So it was trying to basically like stock up. Mm-hmm. So, I went through cartons and cartons of Ben and Jerry's, and bags of Oreos and chips. And it was a lot of like very like high sugar, high salt, highly palatable foods, which is like what you want when you're starving. Yeah. And same thing, like I could not believe, like I have a container of, I really like brownie ice cream. So I have a container of chocolate brownie ice cream in my freezer that I don't remember when I bought. And that my boyfriend yells at me all the time. He's like, you let it go freezer burn. Why?
That is, like, can I just say, that is the perfect example.
There.
That is it. The person this morning said to me, she was amazed that her daughter is able to keep ice cream in her house. Like, she didn't really understand it. And if you don't really understand the principle of deprivation and really truly get it, I think and I can understand, it's hard to imagine, you really would think that you're addicted to food. And that was sort of the conversation that kind of started off with, someone saying, I think I have a food addiction. Yeah. And, we sort of talked about the parts of the brain that light up, and there were so many pleasurable things that make your brain light up.
Laughing.
It's not just about food.
Holding your baby.
Yeah.
No one says you're addicted to your baby.
It went into a discussion about, when you deprive yourself, even in your mind. Like I'm going to give you another example. I have someone I work with who, she wanted to have pancakes when she went to the diner.
Oh, I love pancakes.
Me too. She wasn't going to do it. She wasn't going to do it because she was worried about her blood sugar. Mm. Lo and behold, she binged later. And we talked about that. Like, if you really want the pancake, have the pancake. Play around, see how you feel. It probably, it may or may not affect your blood sugar, but if you're binging, certainly it's going to affect your blood sugar much more than if you just had the pancakes.
Absolutely.
It's the notion of that you can't have something.
Yeah.
I mean, it really goes back to like being a kid. If you want, if your parents say you can't do something, you want to do it all the more.
Yeah, for sure.
That's it in a nutshell.
Also, I also think yes, a psychological restriction is so real in terms of like ignoring our cravings. I also think it's really important to point out that like we live in a world that really normalizes restriction to the point where like a lot of us are physically deprived and we don't even know it. Like we wouldn't think we're physically deprived because we're shown these examples that sort of are like, well, this is how much you should eat. And if you're hungry, then you're wrong. Right? Like we're not taught to listen to our bodies. We're taught to like pretend our bodies are calculators. Right?
Absolutely.
And so like, we're taught to ignore our hunger signals and our cravings and whatnot. So even if we think we're eating enough, especially if we have a background of restriction, which most of us do, it's really important if you're still binging to kind of look at that and be like, am I eating enough? Am I checking in enough? Because more often than not, you're still restricting in some capacity.
That's a very, very good point. And I'm gonna bring it to another level about checking in. Checking in with yourself, seeing, if you're hungry, seeing what you had earlier in the day to eat, maybe what you had the day before. I'm going to use a word that people hate, but I'm going to use the word mindfulness. That's actually a form of mindfulness, just checking in. And every time I even use that word with any of my clients, no, I don't do that, because they imagine it's like sitting and meditating, for hours. It's really just about checking in with yourself. Did I eat enough for breakfast? Do I feel hungry? Do I have hunger signals? And moving forward, it's more difficult when someone has been restrictively eating and has, lost track of their hunger cues. When someone really is deep in the eating disorder and using symptoms, it is hard to check in with yourself. And I'm going to say that's a different situation.
Yeah, I mean, I don't like the term mindfulness for other reasons. Like, I would prefer to say, like, it's important to be in tune with your body, right? Which is technically the same thing as mindfulness.
Yes, no, mindfulness, the word freaks people out.
But it's not even just because of like the idea of like meditation, but also basically, if I hear mindfulness, red like alarms go off in my head. Diet culture, because so many people tout mindfulness as a way, and mindful eating as a way to lose weight or maintain a low weight.
Well, and say something about that. I'm sorry I'm interrupting you, but I have to just get it off my chest. Unfortunately, the diet community has co-opted the words of attunement, intuitive eating, it's attunement. And what did you just say? Being in touch with yourself. They've co-opted the whole notion of letting your body give you information. It doesn't mean you're going to lose weight. And I'll let you talk about that. That was what you were going to talk about.
Yeah, I mean, I don't think that I can, not to say that there aren't any diet programs out there that don't use the term intuitive eating, because they certainly are and increasingly are, but mindfulness is so associated with dieting to me at this point. Like
isn't that interesting? That's information, Ashley. Thank you for that.
Yeah, and like it's unfortunate because mindfulness is valuable in so many different areas of our lives, right? Like it's a good thing to be mindful. But unfortunately, that's not the like pure idea of mindfulness is not what gets kind of described anymore when we talk about mindfulness, which is why I avoid it. I also avoid it because I think that intuitive eating really makes room, at least in my interpretation of it, to not be mindful, right? Like I think that mindful eating is great, but I also know that personally, sitting in front of a TV show while I eat is one of the most calming moments of my day. Does that, sitting in front of a screen while I eat, does that help me keep in touch with my hunger and fullness? No.
No.
But it brings me joy.
Let me make a point about the intuitive eating. It is not a diet. You can do whatever feels comfortable to you using the principles. There's enough room in it's. I almost want to call it. It's not a system. It's a way of being,
right.
And I get it. I don't always want to be mindful. I don't always want to be thinking, having thoughts in my head. In fact, I'll just confess that I've had some rough stuff going on, and I have had no choice. Like, I really have meditated. I really have made it my little thing in the morning, and it is helping, but that's besides the point. Not everyone needs to do that. Sometimes people don't want to think, they just want to relax, just as you said.
Yeah.
But intuitive eating has room for that.
Yeah, exactly. And that's why I like it better than saying mindful eating, because I think that mindful eating, just by virtue of what it's called, makes you feel like you have to always be mindful when you eat. And I don't think that's necessarily helpful. I also think that if you're someone who has an eating disorder background and you're being introduced to this idea of mindful eating, it can sort of feel like just another way to obsess about food, right? And like sometimes you just want to not think about it.
How would you say that then to someone? How would you want someone, a counselor, to talk about being in tune with checking in with your body? Being in tune and checking in.
Yeah, because I think that, it's more of a description rather than like an all-encompassing phrase, which is usually, in my experience, a better way to relay things to people, because it doesn't feel so like boxed in.
Absolutely.
Yep. And doesn't have as many connotations with it, right? Because when you're just describing something, it's not a phrase that diet culture has co-opted, that your eating disorder has co-opted, right? Like, it's just a description of how to be,
yes,
which has a lot more flexibility with it.
Very good point. I like it. Yeah. I want to bring up another point, just changing the topic for one moment, because it's come up a few times in the group, and it comes up in every Facebook group, and anyone who's dealing with the medical system, how hard it is to be an advocate for yourself in this fatphobic world when you go to a treatment provider and they are not health at every size friendly. They say disparaging words with, I'm going to say with the best of intentions. Yeah. One doctor told someone I know who's doing beautifully, labs perfect, everything great, asked if she wanted to have bariatric surgery. That was like a mic drop moment. That was, and I have to say, thank goodness she was armed with enough information to say, no, thank you. I am doing very well, thank you. And the doctor suggested, actually moving forward, the doctor even suggested a type, I'm going to say it, won't say it, but a type of a diet. And again, mic drop. So it's so important to be able to say, I don't want to be weighed. No, thank you. I refuse. Yeah. But it is important to get medical treatment. That's part of self-care. So
yeah, it's really hard because, like, I know personally I avoided the doctor for years because I just didn't want to go in and get fat shamed. Like,
it really sucks. It really sucks.
I still haven't been to a GP. Like, I had a bunch of health issues maybe a year ago or so, and I had to like put on my big girl panties and like get my ass to the doctor. And it was hard, but I finally found someone I felt safe with, which is great. But now, like, I've been living out in the city for 2 years and I still don't have a general practitioner. I haven't gotten my blood taken in like 3 years. Like, I haven't done that.
That's sad. I have
it's like
when we're private.
Yeah. And like, I know that I should. Like, I've been feeling really sleepy lately, and I think it's my mental health medication, which I've adjusted as per my psychiatrist's instructions, but it also could be vitamin D. It also could be, my thyroid. Like, it could be so many things.
Absolutely.
And if I had a GP, I could figure that out more easily. But like, I don't want to go do it. I really don't.
What you're describing is so, first of all, thank you for being so honest. And, you're really reflecting, I know, the attitudes of most people, not just in this group, but most people in the world.
Right.
Not comment about their weight. It's like, anyway, yeah, I'm getting choked up.
No, and it's like, I can have as much body acceptance as I want, but when I walk into that room and immediately get reduced to the size of my jeans, like, it's hard. It's hard, even as someone who works in this field, even as someone who's been in recovery for many, many years and has done a lot of work. it's still hard to advocate for myself. You
It
know,
is
it's
absolutely
still,
hard. Yes.
it still feels like I'm making excuses, and I'm, you know, like it's uncomfortable. And I don't think that until the medical field embraces health at every size, which that's a very far off dream, it's, you know, it's going to continue to be uncomfortable. And I can't even imagine if I was in a larger body. I mean, I'm like a small fat, right?
Yes.
Like,
No, yes, there are people who really do have large bodies
who can't even like fit in the seats in the waiting room, kind of thing, right? Like,
Yep.
how uncomfortable can you make somebody, you know?
It's really,
So
the world is really unfair. I'll just say the
yeah.
world is designed for people in one size body. And by the way, for people who are taller than I am, because I can't ever reach anything in any store.
Yeah, but has anyone ever asked you to try to change your height?
The reason I mentioned it now is because I actually was able to get something off a high shelf for a woman who was smaller than me. That was my moment of joy. I'm very
funny.
short, yes, and that's the point. No one has ever asked me to change my size. I'm probably 4'11". Maybe I'm shorter. I don't know. I'm shrinking.
On your best day, you were 4'11".
I can say I used to be 5'0". Oh, I have such a good picture next to Emmy, the supermodel.
Yeah.
I took that picture
So funny.
at a gala, and you can just see it's like the poodle and the poodle and the Great Dane. I mean, just
Right.
different breeds.
Right. And that's fine, and everyone's fine with it when it's height, but as soon as it's weight, it's your fault. And that's just not true. I mean, like, someone in the Health at Every Size group that we're a part of, Erica, posted this really great visual, which I think she's working on, and it's not released yet, but it's basically like, it was like a circle, and it was like, what determines your size or something like that. And then it was like the biggest circle was genetics, and then this tiny, tiny, tiny circle was food and exercise choices. You know, and the much bigger circle that wasn't genetics was social determinants of health.
So that's correct. Determinants of health, whether you have access to health care, what your socioeconomic status is, whether you have
race.
Race, yes, race is a very big one.
Race is huge.
Unfortunately.
Yes. Yeah. So
I'm upset now.
Okay, well, let me ask you a question that will not make you upset. So I have salmon, but I don't have tinfoil, and I usually make my salmon in the oven. I know you can pan fry salmon. Have you ever pan fried salmon?
I have not pan fried salmon, but I'll tell you what I do is I use a microwave. Do you have a microwave?
Yeah.
I poach salmon all the time in the microwave.
Huh.
And I will share my secret recipe with you.
Yeah. Please do.
White wine in some sort of baking dish, some microwave safe dish. White wine and butter. Salmon. It has to be covered with something, and just cook it. Cook it for like see how. I mean, I don't even know exactly how many minutes, but see how 5 minutes goes. See how 7 minutes goes.
That sounds really good, actually.
It's poached salmon. It's really good.
I love poached salmon. I just have never tried to make it at home.
And then it's like a butter sauce, butter wine.
I love butter. I love butter so much.
Okay, what you're hearing me say is I do really quick cooking hacks. I am not a naturally born chef. I don't know. My son is somehow. I love when he comes over and cooks for us. But I like to get dinner on the table in 5 minutes.
Yeah.
And I'm going to write a blog on that.
Yeah, it's hard. Like, I work from home, and like just getting myself to walk away from the computer to go cook is like, it can be so hard sometimes, because it's like, I need to get this done. I need to get this done. One more thing. And then, it's currently 1:30 and I have not eaten today.
It's very easy to get totally absorbed in something and lose touch. Exactly what you were saying. And then all of a sudden you get up and it's like, oh shit, I'm really hungry. I'm starving. Well,
and not only am I super hungry, this keeps happening to me. I'll like eat a good sized meal. I'll feel full, and then I'm exhausted because my sugar has spiked, right? Because I actually have a lot of diabetes in my family, and I'm very sensitive to sugar crashes and stuff. So if I don't, sorry?
You are very in touch.
Yeah, I know it, but I haven't done anything about it.
No, but you can't change anything you don't know. That's the point.
I've noticed that when I wake up, at a decent hour. I eat a breakfast, a small breakfast, like a latte and some toast, doesn't matter. I don't have that sugar crash after my larger meal at lunch. And I am awake because what I've ended up I've like slept through the second half of the day because I eat my lunch and then I'm like, I can't function.
So. Yeah. So that's, okay, may I say that is intuitive eating. That's learning. That's seeing what works, what makes you feel sleepy, trying something different the next day. It's just trial and error. And by the way, making mistakes. Oh, I want to share something. I have all these things I'm supposed to write a blog on, so maybe it's better if I just talk it through. But I have to see what time it is.
It is 1:20.
So I have someone I'm working with who sent me a picture. It's very cute. It's a picture of a jar of almonds she has in her closet, and she wrote on it, "Do not eat these. You do not feel good after you eat these." Because she loves them and she forgets that she gets really sick in her stomach when she eats these almonds. So that's a reminder. She has to remind herself.
And sometimes it's like, I'm okay with the stomach ache. I want the almonds, like you gotta make the choice.
I take one for the team sometimes if I feel like having ice cream and I'm lactose intolerant, or if I'm on a meal outing and I'm, with someone who has a hard time eating. I will eat whatever they eat. That's the truth. Whatever it is, it doesn't matter. I don't think about it. I just eat it. You take one for the team.
Yeah, but again, that's intuitive eating. It's understanding that, like, okay, I know something doesn't make me feel great, like hot wings. I love hot wings so much. Like, they are one of my go-tos.
It's so funny because that never appealed to me.
Oh my God, I grew up with hot wings. Like, my dad used to make it from scratch. Like, I love hot wings.
There's so much, food is so many associations.
Yeah. But my stomach does not feel good after I eat hot wings. Like, it's not good for like 2 days. And I'd still eat them because they're delicious and I'm fine with it.
Make the decision. Yeah. That's all.
That's what it is, man. Yeah. I like hot wings.
So I'm going to put in a little plug for me and Ashley. We have this wonderful group we're going to be doing, and it's for real. It's for real this time.
For real.
It's starting.
For reals.
For real, starting on March 21st, and it's a week group program live. You get to have Ashley and me, so you get 2 for the price of 1. I'm being really silly. But it's 6 weeks straight. It's going to be Wednesday nights from 7:30 p.m. Eastern Time to 8:30 p.m. Eastern Time. And it's really designed for people on the journey to, toward intuitive eating, but people who might be struggling with some of their eating disordered habits, thoughts, behaviors. And when I say behaviors, I'm not talking about actively engaging in symptom use. I'm talking about people who are still restricting, still having some binging worries, and just really having a hard time getting out of where they kind of feeling stuck. So we're available to help you get unstuck. And it's going to start March 21st. And I'm going to post the link again under this video so that you can sign up.
Yeah, come join us. We talk all about this, and then you also get the support of the other people in the group, which is really, really nice. Because, like, okay, I've been there, and that's great, but I'm kind of far from it. Whereas you're kind of talking with people who are in it at the same time, so you get both perspectives. You get like being in it, but then you also get like the light at the end of the tunnel, which is really nice. And then, of course, you have Erica, who is more of like an expert. So you sort of get like a bunch of different points of view, which can really help when you feel like really stuck where you are. And we always have like the most wonderful people who just like share and are so vulnerable. Like our last group are just like we follow each other on Instagram now. Like they're just the kindest people.
This group, I miss all of you.
Yeah, they're so supportive and lovely. And then towards the end, they're like, "Fuck diet culture," and it's great. So
I want to make a point about that fuck diet culture. The more I see it, the more I work with intuitive eating, the clearer it is to me how eating disorder treatment really does not attack diet culture and really mention it from the beginning. there are so many triggering words that people might use without realizing, eating disorder professionals, I'm saying.
Mm.
So it's so important to just have that awareness. The diet culture is like you're going to be recovering, but recovering into a world that is filled with disordered eating.
Yeah, and part of supporting yourself through that is community, and this group will give you that.
That's correct. Community.
Yeah.
So sign up. It's going to be starting in 2 weeks. There'll be a link under here. It's $149. It's a very reasonable price. So we hope to see you.
All right. Bye, y'all.
Bye, everybody. Have a good day.